The following is a case study presentation by MUIH Health Promotions Master's Candidate Stephanie Kriebel, January 28, 2017. The 4321 Healthy Kids Project was a partnership between a Portage County, Ohio community coalition and Kent State University to develop, implement, and evaluate a nutrition education and physical activity intervention in an effort to reduce childhood obesity rates in local elementary school students. The health problem addressed was increased rates of childhood obesity in the county, which was experiencing higher rates of obese and overweight children than the national average. Researchers used the stages of change theoretical model to guide this study, hoping to see students move toward adoption of 4 healthy behaviors. Data collected prior to the intervention indicated most students were already between the preparation and action stages. This study tested a 2-part intervention, a communication campaign and an after-school nutrition and exercise program to increase awareness and decrease BMI of the target audience. Elementary students in the 3rd through 5th grades were selected as the target audience because of formative research that demonstrated rates of overweight and obese children begin to climb at the 5th grade and higher. Prior to the start of the intervention, the Community Coalition conducted interview sessions and focus groups with students, parents, and school administrators to find out about the audience's behaviors, specific needs, and concerns with regard to fruit, vegetable, and dairy consumption, physical activity, and the amount of time spent in front of a square screen. Based on this information, study researchers decided on 3 intervention strategies. 1, a communication campaign only. 2, an education and communication campaign. And 3, education only. 2 primary communication channels were used in this study, traditional media and new media. Age-appropriate traditional media included logos and color schemes, attractively designed posters strategically placed in schools participating in the communication campaign, and log sheets tracking student activity. New media consisted of bi-weekly email newsletters to parents containing family-friendly tips. Key messages of the campaign were aimed at both students and parents, encouraging them to set goals toward eating more fruits and vegetables, consuming more low-fat dairy products, engaging in less square screen time, and participating in more physical activity. Outcomes of the study included students were able to correctly identify the 4 main objectives both at the end of the campaign and 4 months later, a positive progression in behavior to less than 2 hours daily of square screen time, and 2 of the participating schools continued to use the traditional media materials to encourage healthier school environments. All of these outcomes warrant further research and development to determine if an intervention longer than 10 weeks will elicit more behavior change. Study limitations included students had difficulty understanding how and remembering to complete their log sheets. There was possible volunteer or self-selection bias because participating schools were self-selected. At only 10 weeks, the length of study was too short, and the lack of parental involvement. There were several lessons learned in this study. 1, researchers need to identify ways to engage parents directly in the campaign in order to achieve significant results. 2, it is important to directly involve community constituencies at all phases of the study. 3, novelty in campaign messaging can increase message retention. And 4, using and layering multiple communication channels can dramatically increase message effects. Despite the length of the study, I think the communication campaign was designed and implemented well. Traditional media color schemes, logo, and posters were vibrant, attractive, fun, and recognizable. While the e-newsletter contained good information, it should have been designed better because it was text-heavy and cluttered. Additionally, the activity log sheet was boring and did not make me want to fill it out, so I can only imagine how a child would feel about it. This is an opportunity to create a different, more attractive solution for tracking student activity. One suggestion is to create a fun, engaging app with lots of cool graphics, ease of choice, and navigation that wouldn't require so much parental support. Disappointing to me was researchers seemed to place most responsibility for lack of parental involvement on the students not delivering activity logs as instructed. To their credit, researchers did cite that parents could have failed to help their children complete them at home, and I would argue extenuating factors and barriers to be a determinant. Either way, researchers did acknowledge the need to identify strategies for better parent engagement in future campaigns. My last critique is the incentives provided to students for completing their activity logs. This could be a cause for bias in that once students found out they would receive a prize for completing the form, they may have filled out the forms with just any activity versus actual activity in order to get the incentive. Overall, I think this was a well thought out campaign for an initial intervention.